So 3 of the vaccines that have been used to date in trials have shown that they've been effective against the South African variant at a level greater than was set as the minimum standard by WHO and the US FDA. We expect all other vaccines to have a similar level of effectiveness, particularly in reducing hospitalisation and death. And we're doing detailed laboratory studies at the moment with the South African variant growing in the labs so that we will be able to estimate that with greater robustness over the next couple of weeks. The most important thing that everyone can do right now is follow the hands, face, space and stay at home message. Those are the key things that we'll do to reduce the virus transmitting to others, and the additional measures that we've put in place, enhanced contact tracing, enhanced testing in those areas, will help us. We will continue to watch the genome sequencing data very carefully for any new variant that emerges and enhance the efforts that we put to try and our best to reduce the spread of these variants.
The contact tracing system now finds 95%, around 95% of those contacts. So it has built up to this very effective level. And in addition, by sending people door to door and working with the local authority, we're trying to find all of the possible contacts and ensure that they isolate, of course, which is the way that we're going to get this under control.
These cases do not appear linked at the moment. I think they're in quite separate parts of the country, and they're more likely to be related to somebody who potentially had asymptomatic infection when they came in from abroad. We are looking to find extra cases in the community to see where we can find links and to try and close down and eliminate the transmission between people. I think it's really important to also add that with the R value just below 1 as it is in the vast majority of the country, that we can reduce these cases of the new variant, and along with additional testing and people taking even more control than they are normally, then this will all help us do that. In terms of the tweaked vaccine, we're already working and looking at that, looking at what mutations are particularly common that might be important to be put into a tweaked vaccine. It is unlikely that people would have to start again, much more likely that it would be a booster shot, a bit like the annual flu vaccine.